about we're talking about environmental AMS, and it's my pleasure to welcome you all to this session. This will be recorded and made available on the NCAS website after the session. If you have any questions, please put them in the Q&A section at the bottom of your screen. Alternatively, if you'd like to speak live, then please let us know. There will be some time for questions and discussion at the end of the presentation. I have two speakers today, but I'm not sure if the second one will actually be able to speak live. She's currently dealing with a transport situation. But we at the very least have in the room Claire Hayward. Dr. Claire Hayward is a postdoc research fellow with the Cooperative Research Centre for Solving Antimicrobial Resistance in Agribusiness, Food and Environments, otherwise known as the SAAFE, CRC, based at Adelaide University. Her research focuses on quantitative risk assessment of antimicrobial resistance across environmental, agricultural, and public health settings. Drawing on Bayesian modelling and systems thinking frameworks, her work simulates AMR exposure and transmission pathways to evaluate the efficacy of potential interventions, providing an evidence base for future management strategies across sectors. Thank you, Claire.
Yeah, I'm just going to make sure that my other way swap. There we go. Hopefully you can all see my slides there. Thank you for that fantastic introduction. As you said, my name is Claire Hayward. I'm based at the Mawson Lakes campus at Adelaide University and SAAFE CRC. And I'm just going to move you guys out the way there. And today I'll be talking a bit about some of the work I'm doing and giving a background to environmental antimicrobial resistance and introducing some of that risk assessment modelling that I'm doing. So for today's presentation, we'll start with what the question of an environmental blind spot looks like. Then we'll move through to look at the different mechanisms of AMR in environmental settings, particularly looking at sub-inhibitory selection pressures. And then we'll move on to talk about a few different specific hosts and physical hotspots where we believe that resistance might be concentrating. And then finally, I'll introduce and talk through our Bayesian network framework that we're developing to try and tackle some of these issues. So we'll start with the environmental blind spot itself. So typical AMR stewardship looks like focusing on the centre and the clinic and healthcare settings, which has a significant evidence base and is critically important when we think about clinical antimicrobial resistance. And then we have the veterinary and agricultural sectors that have come under recent increasing scrutiny as well. And we're starting to see an increase of policy around this space, seeing bans on antibiotics used as growth promoters, not using critically important antibiotics in agricultural settings, and so on. But the environment sits largely outside of both of these frameworks. There's no real global equivalent of this healthcare stewardship for things like wastewater treatment plants or effluent discharge. They're not designed to deal with or remove antimicrobial resistance. So we have a bit of a blind spot. We don't really know how these particular settings are dealing with antimicrobial resistance and what role they play. The environment is often treated as a passive sink where these antimicrobials, the resistance genes and these different pathogens might be accumulating. And what we're increasingly realizing in our work and more broadly is that the environment is actually playing a really active role to amplify this resistance in certain settings, but also conversely, a really important role in potentially mitigating some of these risks as well. And it's these two gaps that our work is really framed around. So when we look at the dynamic role of the environment into antimicrobial resistance, it's a real bidirectional role. And that's what makes it quite challenging, particularly for our modelling work. On the input side, we have antimicrobials and chemical stresses that enter a particular system, for example, through excretion. So you're prescribed antimicrobials, they go through you out through to the sewage system, for example, and we're metabolizing only a fraction of those. We have healthcare settings that are contributing a significant number of resistant bacteria directly to these sewage systems, agricultural operations maybe contributing through soil, manure and runoff, for example. And the environment, as we said, doesn't just receive this material, it also returns it back out of this system. So resistant organisms may re-enter food chain. So in agriculture, if we're using surface waters or recycled waters as an irrigation source, they can re-enter that food chain there. The antimicrobial resistance genes can accumulate in drinking water catchments, for example. And this is where we can start to see some novel resistance combinations emerge because we have a variety of different interacting sectors. We've got wildlife, human waste, and environmental runoffs. So this is really emphasizing that the environment is not just that passive receiving sink, it's more of a complex reactor that is brewing all of these diverse inputs. So how does environmental amplification actually work? And here I'll run through a few different mechanisms. So the concept that has changed how we think about environmental AMR risk is the MSC, or minimal selective concentration. The MIC, or minimum inhibitory concentration, that you would all be quite familiar with, tells you the concentration at which an antimicrobial kills or stops bacteria growing, and that's kind of this red section here. But bacteria can be selected for resistance at concentrations far, far lower than this MIC level, where there is still a fitness advantage to being resistant for that particular bug, even if the drug isn't completely inhibiting growth outright. The MSC is that threshold, and that's here just before this yellow section. It can be 100 to 1,000-fold lower than that clinical MIC, and it really differs depending on the chemical agent we're talking about. Environmental concentrations routinely exceed this MSC, particularly for highly impacted environments like receiving waters that might be getting effluent discharge, agricultural runoff, and a number of other inputs. Standard risk thresholds that have been started to be thought about, particularly in Europe, may be interpreting these numbers potentially problematically. So at the moment, some of those thresholds that have been posed are based on these clinical concepts of resistance, not really taking into some of the ecological complexities or realities of certain environments. And often what happens is they're developed by taking 1% of the lowest observed MIC values for a particular antibiotic. They will then calculate a PNEC, which is a predicted no observed effect concentration. And what that does is applies an additional safety factor of 10 to try and account for differences between these MIC and MSC values. Stick with me here. And what that does is we've taken a clinical strain of a bacteria and a clinical measurement of inhibition, and then applied a somewhat arbitrary safety factor, and then developed a potential regulatory value for an environment where we've just taken 4 steps away from what that ecological reality might look like. So in our Bayesian network that I'll speak to a bit later, we're starting to use these MSC thresholds as part of our risk assessment to try and understand what these proposed regulatory thresholds might look like in a particular context. So the second mechanism is co-selection, and that complicates and multiplies the scope considerably. So when resistance genes are co-located on a same mobile genetic element as metal tolerance genes, which is well documented for metals such as copper, zinc, and lead, applying metal-containing biosolids or a particular agrochemical to agricultural soil can select for clinical antibiotic resistance, even in the absence of that antibiotic itself. Biocides then add an additional complicating layer. Things like quaternary ammonium compounds in hospital disinfection can drive cross-resistance to clinically important antibiotics as well. Things like triclosan resistance is well documented across multiple classes of antibiotics. And when we're looking at water treatment and disinfection, things like chlorine resistance uses machinery inside an antibiotic called efflux pumps. And those efflux pumps are the same machinery that are used in antibiotic resistance as well. Now, when we think about the environment, all of these stresses co-occur in multiple pathways, particularly in wastewater treatment plants, for example, and mixture effects are not captured well by evaluating one single stressor in isolation. We're trying to understand questions like, are they additive? If we have metals and biocides together, are they inhibitory? Does the presence of one lessen the effect of another? And these are questions that we don't yet know the answers to. And so for our risk assessment project, we're trying to account for these mechanisms across multiple classes of antibiotics, and then also passing out these other chemical stresses as well, so we can understand which particular aspect of this chemistry might be driving an increased resistance risk. So now I want to spend a moment on a vector that gets a little bit less attention sometimes, which is free-living amoeba. So acanthamoeba or Naegleria species are somewhat ubiquitous when we think about water systems or natural water sources, biofilms, and soil. They can internalize bacterial pathogens, and they provide a nice, safe intracellular niche to protect these bacteria from the stressful environment around it. Inside that amoeba, bacteria from different strains, different lineages are now in very close proximity to one another, and they can begin to exchange resistance genes at a rate or occurrence that wouldn't necessarily occur in that open, free water system. And when we think about the clinical pathogens that we might care about the most, and this is harking back to my PhD days, so ones that I cared about the most, were Legionella, Pseudomonas aeruginosa, Acinetobacter baumannii, are all documented to be amoeba residents and co-occurring together within the same amoeba. And Pseudomonas strains can recover after internalization in an amoeba and show increased antimicrobial tolerance, particularly when they're co-occurring with their fellow friends like Acinetobacter. And Legionella that are housed within an amoeba can survive water treatment, heat disinfection of up to 70 degrees. So you may be disinfecting or heat treating a water system to a point where the bacteria should be dying, but because they are within that amoeba, that disinfection is no longer effective. Zooming out a few steps now, we can identify 3 broad categories of hotspots that we believe that might be playing a key role in either this increase or decrease in resistance development. So wastewater treatment plants are a key example because they receive concentrated inputs from diverse sources, so hospitals, industry, municipal waste as well. And the treatment systems are not designed to remove resistance genes or particular chemical stresses. So we're really trying to understand what their performance looks like in the context of AMR. We have agricultural soils and food systems. So when we talk about things like biosolid and manure application as fertilizer, can be inadvertently inputting some of these resistance genes and bacteria into food producing soils. And a range of studies within SAAFE CRC and more broadly have found some of these resistance genes on vegetables at the point of consumption. So we're really trying to understand at what point in that supply chain might these genes be being introduced. Is it during harvest when we are using things like recycled water and biosolids? Is it beforehand in the nursery where the seedlings are particularly vulnerable? Or is it post-harvest during processing and washing and handling that we might be introducing these? And by identifying those points, we can best set some interventions to make sure that we're protecting food safety. And then in built environments, things like hospital premise plumbing, biofilms are well-documented reservoirs for these pathogens and particular resistance traits. And then hospital wastewater carries the highest multi-drug resistance burden, which makes sense given the context. And we are trying to account for things like sewage overflow events to make sure that we're not, or that we're capturing potential redistribution pathways of this critically important wastewater source. So we know that AMR moves through these environmental systems, but we're not quite sure how. And here's where I start introducing some of the structure to our Bayesian network. So we've got our determinant sources that we've touched on there, being the farm inputs or antimicrobial use. and they may enter a particular environment through a number of different ways. It could be the soil, it could be water runoff, or in agriculture, it's more of a unique situation where it's directly inputting into that environment. Then it's occurring in a pathway, but we're not too sure, and this is kind of the key questions we're trying to answer with our Bayesian network is this resistance just persisting through and just transferring through that pathway? Is it transforming? Is it increasing or decreasing? And then how is it exiting that pathway through a product, like I just talked about, through food safety, through effluent discharge into a receiving environment, and so on. And so these are some of the key aspects we're trying to address. So we don't know how these resistance concentrations change as they move through different pathways. We know that there are those multiple interacting variables. So when we talked about different chemical stresses and how they may be additive or not, and how those chemical stresses might be persisting as well. Are they breaking down in a certain system and they're no longer selective, for example? But the real issue that we're coming up against is that data are quite sparse and inconsistent. We are trying to leverage considerably from existing international literature, and we're just trying to deal with how data collected for other purposes may be reused in our Bayesian network, and how we can reconcile different collection methods and analytical techniques as well to best make our BN perform the way that we are after it to. So this is why we're taking a systems thinking approach to this environmental AMR context. So AMR doesn't move in isolation. It's not like a traditional chemical hazard where it just moves through pathway points. It's dynamic, as we've spoken about. And when I say pathway point, that's really any location where AMR can enter, accumulate, transform, and exit, and so on. I'll give some examples in a second. And on the right-hand side here, we have the conceptual framework that our Bayesian network is built off of. So we have entry points, and in this example, I have a sewage system where those antimicrobials and organisms are entering a pathway. Here we've got the wastewater treatment plant as an example, where it may be persisting or transforming. It then exits our wastewater treatment plant via a number of different routes, being effluent discharge, recycled water, and biosolids, and those then enter their next system, and so on and so forth. So here is that system, and I showed a version of this diagram when I presented last year, but this is updated and shinier. And this is co-produced with our industry partners on this particular project, being SAEPA, SA Water, and SA Health. And here we can see how these different pathway points are incredibly interconnected. I have them broken up here by their broad sector. So the water sector being there in blue, kind of in the middle, and they are the real joiner between all the sectors. We have agricultural pathways down the bottom there in green. We have the environmental sector kind of broadly in pink over there to the left. And then in the top right, we have our human and animal receptors. And what the dashed arrows are showing us is that those are the links between two different sectors. And we can see that there are far more dashed arrows than there are solid ones, really emphasizing the interconnected nature of these environmental systems. And finally, I'll just touch on our Bayesian network framework that is trying to deal with these issues. So why a BN? It's probabilistic by design, and it can produce a probability distribution. They are great at modeling complex dependencies, as we touched on earlier. We have a lot of different variables that we are trying to deal with here. It's great at integrating the sparse data sets that we're working with, so it can combine the quantitative data that we're getting from our industry partners, and we can also engage in expert elicitation to try and fill these data gaps where relevant. And then finally, it can support decision-making. So managers or our partners can ask what-if questions. What if we applied a treatment here? How would that shift our risk probabilities throughout the rest of the network? So here is the top line structure. So we take different data sources. So we've got our surveillance data, environmental variables, so we can anchor our Bayesian network into a specific area or context. We then look at management practices to understand how we are using these different systems. Those data sources all feed our Bayesian network model, and this is a very high-level version of it, and I'm more than happy to go into more detail with anyone afterwards if they would like to. And then what our Bayesian network can tell us is a few different things. So we can look at the risk probability. At this stage, we are looking at human health risk. So at each of these pathway points, if one would be to exposed through inhalation or contact with that particular product, what would their human health risk look like at that point? And if it exceeds a 1 microdaley measurement, which is a kind of conservative public health risk threshold used, it can perform a sensitivity analysis, so it can tell us which variables are driving this increased risk. Is it because we have too many metals, or there's a lot of resistance bacteria coming through a certain waste stream? It can identify those variables for us. As I just touched on, it can support scenario testing. So if we were to pre-treat hospital waste before it came into the wastewater treatment plant, how would that shift the risk? Would it be appropriate? And we can also apply economic implications to that as well. So what is the lowest cost, best impact options that we have within each sector? And it can also support pathway rankings, so comparing risk across multiple different sectors and pathways as well. So I had just mentioned that the BN is designed to be a decision support tool. So it identifies primarily at the beginning existing management approaches. So we really want to support what is already being done on the ground and how we can tweak those different interventions to best address antimicrobial resistance before we jump to fancy and expensive treatment barriers that may be unnecessary. Then it can highlight opportunities for innovation. So understanding what is being done in one sector and leveraging that and seeing if it can be applied in another. Then it can also balance these trade-offs. So yes, we are trying to minimize antimicrobial resistance health risk, but we also understand in these sectors there are also competing priorities as well, things like PFAS or carbon reduction schemes. So how can we best balance AMR intervention with these other priorities that may be regulatory requirements for that particular sector? And it can also be delivered to our partners as a self-assessment tool so they can understand their own role within these antimicrobial resistance pathways and how they can best manage their particular system. And we can do that by customizing our BN to their particular context. So for example, Sydney Water want to say, what does our wastewater treatment plant look like? And we can plug in certain variables to make sure that it's reflecting their scenario. This entire project has been co-designed with industry. So we can make sure that the tools that we are developing directly speak to their needs. And then in future, this BN will be expanded beyond human health risk to look at key animal health and plant health risks and anchoring that in the SA sector specifically. I would like to finish up my presentation here and acknowledge the research team that have been working tirelessly on this project. So this has been led by Professor Nick Ashwell out of Queensland University of Technology, and then also a large team out of Adelaide Uni. And I've been saying the word "we" quite generously to myself for this Bayesian network development. And the real brains behind this has been Stephen and Owen out of Bayesian Intelligence as well. I've got a QR code screen up here, a QR code on the screen here that will take you to the SAAFE CRC website, and it will describe a bit more about our risk assessment projects within the CRC. Thank you.
Thank you so much, Claire. That was awesome. While people are thinking about their questions, I might ask a question. And I know what you're doing is creating this wonderful framework so that we can evaluate potential interventions. But I always have to know the answer first. What interventions do you think are going to work the best for, say, wastewater treatment, which seems to be one of the biggest challenges with AMR?
Yeah, there's a few different options. I think that it's been interesting because a lot of the current discussion has been jumping to quite innovative technologies, things like reverse osmosis and so on, that yes, are effective at addressing antimicrobial resistance, but are significantly expensive and logistically not feasible for a lot of operations. So at the moment, what we're trying to do is break down the wastewater treatment plant into their certain stages so we can understand, is it activated sludge or is it filtration that's having the best impact, and really seeing if we can just dial in those operations. What we're finding is the wastewater treatment plants actually pretty great. And it's really dependent on the diverse input sources that they're getting. So it might be just a matter of understanding the trade waste inputs or the hospital waste that's coming in. And we've spoken a bit about if it would be a pre-treatment on some of these waste streams. That's one of the management levers that we're incorporating in. But what I suspect will happen, it will be a combination of multiple tweaks rather than relying on one new shiny barrier. It will be understanding the role of each of them and having that multiple barrier approach, and making sure that an intervention that we recommend, be it pre-treatment, is not unfairly burdening that upstream producer with the cost and logistics and so on. So what I suspect we'll be recommending would be more of a spread across multiple treatment approaches. I hope that makes sense.
Thank you. There are some questions in the Q&A. Anna says, how do you evaluate risks? This is a hard question. How do you evaluate risks when there is so much unknown, i.e. a lack of data?
Yeah, absolutely. And that's our biggest challenge at the moment. What we're trying to do at this first stage is parameterize or feed our model with the best available data that we have. And we're working with our industry partners to see if what they're already monitoring for, and a lot of that is around the chemistry, can be used. And then we're supplementing that with the monitoring programs within the SAAFE CRC. So out of WeHi and the University of Melbourne, they're working a lot on monitoring for the genes and the bacteria, so we can combine those sources to kind of make the best model that we can at the moment. What that will do is give us an understanding of where the real key gaps are, and then we have the capacity to do some targeted sampling there. And then once we have that kind of first pass, that'll give us an understanding of where our risk thresholds are. And if we're comfortable with, if it is flagging as an increased risk, say at effluent discharge and that receiving water, and if someone goes swimming, that might be an elevated risk, we can backtrack and look at the data that are feeding that output and say, are we happy with the quality of data that we have there? And working with the EPA and the water utilities that would be relevant to that exposure point, are they comfortable with the data that are feeding that and the quality of that? If they are, then we can make some decisions based on that output. And if they're not, then that might be where we go and collect some more robust data with the platforms that we've developed within SAAFE. So it's kind of a sequential approach that where we're seeing an increased risk flag, then we can really go back and make sure that the data that we're using are robust enough to actually make decisions off of that.
Chloe has some questions about hot and cold water. There seem to be two. Does cold water need to be treated with hot temperature, 60 degrees, before it goes into the cold water pipes? And if the hot water system has failed to kill Legionella in the first place, how can cold water not be affected? Chloe, did you want to if Caroline is on the line and can unmute you, we could perhaps have you ask that live if you wanted to clarify, or are you on top of that question, Claire?
I think I might be on top of that question. So the cold water system is still a risk for Legionella. It's mainly that warm space in the middle is kind of flagged as the higher risk. So it's, I don't know the numbers off the top of my head. It's like under 40 degrees and below 15, I want to say. This is taking me years back. And it's that warm water system that is an increased risk for Legionella growth. The cold water systems can be treated with either heat shock or disinfection and then stored, thus making it not hot anymore, and then delivered to the patient or whoever's on the end of the line. But the hot water systems, because they typically sit within the pipes in that warm kind of area, we don't have refrigerated pipes, then they'll be heat shocked and then hot water is delivered to the patient at the end. And it's that hot water treatment that has been used as a additional water disinfection tool that can be ineffective against Legionella, particularly when they're either in a biofilm or in an amoeba. So there are disinfections applied to both cold and hot water, and they're usually delivered separately in separate pipes. When those pipes are close to each other, they can warm each other up, and then putting them into that kind of critical risk threshold space. of which the numbers escape me now.
No worries. Leslie also says, you mainly talked about sub-inhibitory levels, but will your work help with the opposite problem? I'm not sure. Leslie, do you want to clarify that? Can we? Oh, she says she's in a noisy environment. She said, years ago, I heard a journalist speak about wastelands where nothing grew around antibiotic and chemical manufacturing factories in places without waste controls outside Australia.
Yeah, definitely. When we've, and that's been going back to that previous question about data, something that we've had to look at quite closely when we're using international literature is a lot of data is coming out of countries where they don't have these manufacturing controls. And in Australia, we have far less of the antimicrobial manufacturing itself. So it's not at the moment as big of a deal. But where there are settings where we have significant manufacturing and less of these regulatory controls, the concentrations that are coming out of these waste streams are kind of crazy when we think about it in an environmental context where we are used to seeing these quite low numbers, and then we're seeing thresholds up closer to those MIC values. It's definitely a concern internationally. At the moment, we're building it for the Australian context, so that's not as high of a priority on our radar because we don't usually see concentrations that high. But if we were to transplant our BN to an international context, it definitely can deal with these increased values. It can kind of go as high as discharged. It's definitely in the capacity of our framework, but it is kind of terrifying when we see some of the industry waste discharges into environmental streams that are combining very high levels of metals with antibiotics if it is a antimicrobial manufacturing facility as well.
Thank you, Claire. And thank you for shining a light into what is really often a very dark corner of this One Health AMR, AMS space. That's been really enlightening. So thank you very much. I'm just going to check where we are with Robin, who was our second presenter. Kaz, are you online and
I
able to?
am. Yeah, so Robin will, unfortunately, she's not able to present live, so she'll record her session afterwards and we'll email it, promote it around to everybody. So happy for you to continue with the Q&A, but otherwise we can also wrap up early.
Okay, well, we might, I think we have, unless anyone else has a question they want to add, we might have an early wrap up today. And yes, please do log in about a week and hopefully we'll have Robin's talk uploaded for everyone because it's really interesting for everyone who's interested in agriculture, AMR, and particularly antifungal AMR. I think Robin's talk will be really interesting, so don't miss that. Okay. Well, the recording, as I said, should be available on the NCAS website in about a week's time. And the next session is on Wednesday, the 15th of July. And the theme of that one is local to global AMS. And we'll hear about AMS implementation experiences internationally. So thank you very much for joining us this morning. And thank you, Claire.
No worries at all. Thank you for having me.
Thanks, Claire. Bye, everyone.
Bye.